The wrong pill can kill your loved one. Your grandmother takes 5 pills every morning. Your father swallows 3 more at lunch. Your elderly neighbor keeps a pharmacy in her kitchen cabinet. They all believe these medications are keeping them alive. But what if those same pills are slowly destroying them? What if the medicine meant to heal has become a silent weapon targeting their fragile bodies? You're about to discover 2 critical truths. First, 7 common medications are causing devastating harm to millions of older adults right now. Second, the most dangerous one is sitting in medicine cabinets everywhere, considered completely harmless by most families. Here's what haunts medical professionals. Countless seniors collapse without warning. Mysterious internal bleeding appears from nowhere. Mental confusion mimics Alzheimer's, but isn't. And the culprit? Often the very medications prescribed to help them. But there's something even more disturbing we need to address before revealing these dangerous drugs. The body betrays itself after 60. Understanding why medications turn toxic requires grasping one essential fact. The aging body processes drugs completely differently than younger bodies. Think of it like installing a race car engine into an old compact vehicle. Everything breaks down. The liver slows dramatically. The kidneys filter much less efficiently. What healthy adults eliminate quickly accumulates dangerously in elderly systems. And within this accumulation lies the deadly threat. But the nightmare deepens. When seniors take multiple medications simultaneously, these drugs wage war inside their bodies. They create cross-reactions that trigger cascading problems. Doctors call this polypharmacy. Families call it the pill routine. Scientists call it a ticking time bomb. Yet most people have no idea which specific medications pose the greatest risks. That's about to change. Danger number 7. The pain pills everyone trusts. Walk into any home with elderly residents. Open the medicine cabinet. You'll likely find ibuprofen, diclofenac, ketoprofen, or similar anti-inflammatory drugs. People pop these pills for headaches, muscle aches, joint pain. They seem utterly harmless. For older adults, they can be tickets to the emergency room. These non-steroidal anti-inflammatory drugs attack the stomach lining relentlessly. They dramatically increase the risk of bleeding ulcers in seniors. Digestive hemorrhaging becomes a terrifying possibility. And that's merely the first strike. These medications assault the kidneys simultaneously. Acute kidney failure can strike seemingly out of nowhere. Some varieties also damage the liver severely. If the elderly person already struggles with high blood pressure or heart conditions, these drugs destabilize everything. It's a triple assault: stomach, kidneys, heart. Imagine the senior's stomach as a delicate balloon. Each dose of anti-inflammatory medicine acts like a needle trying to puncture it. Meanwhile, the kidneys endure relentless pressure until they simply stop functioning properly. Many people end up requiring dialysis. If your elderly loved one takes these medications regularly, stop immediately. Speak urgently with their doctor about safer alternatives like acetaminophen. Always under medical guidance. Never gamble with anti-inflammatory drugs in elderly care. It invites catastrophe. But there's a medication class that causes even more immediate danger. Danger number 6, the sleeping pills that cause falling. Older adults often receive prescriptions written on special controlled forms. Medications like clonazepam, alprazolam, lorazepam, diazepam. These drugs calm anxiety and promote sleep. They also rank among the leading causes of household accidents in seniors. The slow metabolism of aging bodies makes these medications linger far too long. The results prove devastating. Daytime drowsiness becomes constant. Motor coordination deteriorates severely. Dizziness strikes without warning. It's like walking drunk without consuming any alcohol. This multiplies fall risk astronomically, and falls in elderly people aren't simple stumbles. They open doors to broken bones, surgeries, immobility, complete loss of independence. Additionally, these drugs cloud thinking, cause profound confusion, worsen memory. Symptoms easily get mistaken for advancing dementia. How many elderly people have you seen stumbling, swaying, appearing lost, especially during morning hours? This medication class might be responsible. Benzodiazepines should be used rarely in elderly care. Only exceptional circumstances. Very brief duration. Discuss with doctors how to discontinue these medications or replace them with safer alternatives for anxiety and insomnia. Alternatives that won't transform your loved one into a zombie prone to deadly falls. Yet another common medication hides an even more insidious threat. Danger number 5. The cold medicine that steals minds. You might wonder how such ordinary remedies could cause harm. As stated before, certain things become dangerous specifically for elderly people. These medications carry a hidden threat. They possess strong anticholinergic effects. This includes not just cold medicines, but also older allergy medications, motion sickness drugs, intestinal cramp treatments, even older tricyclic antidepressants like amitriptyline. The danger isn't visible in the name, but it lurks there, behaving treacherously. These drugs drain a vital substance from elderly brains, acetylcholine, the fuel for memory, thinking, movement. What happens next? The elderly person becomes suddenly confused. Memory deteriorates terribly, vision blurs, mouth feels desert dry. The intestines stop completely, causing severe constipation. The bladder doesn't empty properly. It's a direct assault on the brain and basic bodily functions. Consider this carefully. These symptoms resemble dementia or Alzheimer's so closely that they often get ignored or misdiagnosed. Families believe the disease is progressing. In reality, the medication is causing everything. Therefore, ask doctors about the anticholinergic effects of elderly medications. If they're using anything from this list, demand to know if alternatives exist without these devastating effects on elderly mental function. But we're approaching the medications that pose even graver dangers. Danger number 4, the heart medicine with razor-thin safety. People with weakened or enlarged hearts take numerous medications. One very well-known drug is digoxin. Doctors use it to control heart rhythm and strengthen contractions. Seems beneficial. For elderly patients, it resembles walking a tightrope. Elderly bodies struggle to eliminate digoxin. It accumulates. Toxic levels develop with frightening ease. The warning signs? They begin with subtle symptoms like appetite loss and nausea. Then mental confusion arrives. They see everything tinted yellow. Some historians believe Van Gogh suffered digoxin poisoning. Most dangerously, it triggers other heart rhythm disturbances. Some prove fatal. The difference between helpful dose and lethal dose is minimal in elderly patients. It requires surgical precision and constant attention. Doctors use it less frequently now. Here's critical advice. If your elderly loved one takes digoxin, ensure blood tests measure drug levels regularly. Monitor kidney function closely. Ask the doctor directly. Is digoxin truly necessary? Are there safer options available? In most cases, yes. Safer alternatives exist. Only 1 or 2 situations genuinely require continuing digoxin therapy. Danger. Number 3. The diabetes drug that drops blood sugar dangerously. For elderly people with diabetes, pay extremely close attention now. We're not discussing metformin or newer medications. Rather, sulfonylureas like glibenclamide or glimepiride present enormous risk for severe hypoglycemia. Seriously enormous. These medications force the pancreas to release insulin, driving blood sugar levels sharply downward. In elderly people who often eat less or have irregular schedules, this drop can be brutal and rapid. Hypoglycemia causes acute confusion in seniors, simulating stroke symptoms. Severe dizziness strikes. Sudden weakness overwhelms them. Risk of fainting, falling, head injuries becomes extremely high. Untreated hypoglycemia can cause permanent brain damage or death. Worst of all, elderly people might not sweat or shake like younger people experiencing hypoglycemia. The only symptom appearing is confusion. This gets easily attributed to aging or dementia. Be vigilant. Confusion can be an elderly person's cry for help. Choose safety instead. Modern medicine offers much safer diabetes medications for elderly patients. Medications with minimal severe hypoglycemia risk. Metformin when tolerated, dapagliflozin, other newer classes prove preferable. Speak with doctors about switching treatment to options protecting elderly people from this constant danger. We're nearly at the top of this deadly list. Danger number 2, the sleep aid that creates nightmares. Zolpidem once dominated prescriptions for insomnia. Fortunately, prescribing became more controlled. It remains one of the primary causes of nighttime falls and morning confusion in elderly people. The worst part? It can cause amnesia where people unknowingly spend money online, wash dishes, cook food. Zolpidem, sold as brand names like Ambien. This sleeping pill that worked like magic. That magic can become nightmare. Additionally, it sometimes causes bizarre half-asleep behavior in elderly people, eating, walking, talking without later memory. One patient rolled downstairs, broken ribs, fractured femur. When her son arrived, she swore someone broke in and pushed her. Nothing was stolen. The son checked security cameras. She was sleepwalking, wandering up and down until she stumbled on stairs. You see, Zolpidem induces sleep quickly. But in elderly people, effects don't fade quickly. It remains in the body longer, causing residual drowsiness the next morning. Dizziness, especially balance problems and coordination issues when rising at night for bathroom trips. It's the perfect recipe for a fall in darkness. This affects not just elderly people. There was the case of a congresswoman who broke her teeth, thought someone broke into her apartment. It was Zolpidem. Therefore, insist that Zolpidem be the last option for elderly insomnia, used only very briefly. The foundation of insomnia treatment at this age should be sleep hygiene, routine, and if medication becomes necessary, options with lower risk for prolonged sedation and falls. Speak seriously with doctors about Zolpidem dangers for elderly people. Seek alternatives. And danger number 1. We've reached the top of our fatal list. The medication found everywhere in nursing homes, the one many consider a harmless protector. The truth? It's one of the most dangerous silent villains in elder care. We're talking about proton pump inhibitors, the famous PPIs. Names like omeprazole, pantoprazole, esomeprazole. They get used to protect stomachs or treat reflux and heartburn. But with prolonged use, and in elderly people this is almost always the case, they disarm the stomach. The stomach needs acid to kill bacteria we swallow. PPIs remove that acid. What happens? It increases risk of terrible intestinal infections like Clostridium difficile, which causes uncontrollable diarrhea and can be fatal in elderly people. It increases pneumonia and sinus infection risk. And the damage list continues. Prolonged use destroys bones, increasing osteoporosis risk and hip fracture risk. Hip fractures rank among the leading causes of disability and death in elderly people. It causes severe vitamin B12 deficiency, leading to neurological problems and anemia. Studies point to disturbing connections with chronic kidney problems and even worsening dementia. People take omeprazole like water, thinking they're protecting their stomachs. Actually, they're opening doors to a cascade of other much more serious problems in elderly bodies. Most seniors taking omeprazole for years no longer need it, but they continue from inertia, lack of reevaluation, simply because they think it's normal. And precisely here, the toxic effect establishes itself. Check if your elderly loved one has been taking omeprazole or similar medication long-term. Speak with their doctor. Ask directly, is continuing this medication truly necessary? What are the long-term risks? Can we try discontinuing it? In many cases, supervised withdrawal of these medications is possible and necessary. It protects elderly people from greater risks. You've seen how crucial knowing this list is. You've seen the value of being informed and part of our community. We address important health topics always. Today's list represents the hard truth many doctors and patients ignore or underestimate. 7 common medications, 7 real and devastating dangers to our elderly loved ones. The danger doesn't lie only in diseases. Often it hides in what gets prescribed for treatment or protection. Polypharmacy is challenging, but lack of information and inertia are even bigger enemies. Become an agent of change in the lives of people you love. Print medication lists. Research them. Speak openly with geriatricians or physicians treating your elderly loved one. Asking questions means caring. When possible and safe, discontinuing prescriptions can save lives. Medical professionals always try reducing patient medication lists when feasible. Take action to protect the elderly person you love. Review their medications. Schedule a doctor appointment. Share this information with others who need it. Your awareness can save a life. Your action can prevent tragedy. Your voice can protect someone precious. Knowledge is power. Sharing is caring. Acting is loving. Share this video with your family and friends. Subscribe to stay informed about critical health information. Together we can protect our elderly loved ones from hidden dangers.